The students that we offer placement to are adult branch students as well as learning disability specific branch students. We offer a combination of 4-week placement, also an 8-week placement and a 12-week placement depending on learning outcomes that need to be achieved. Our placement that we have is very diverse. We've got loads of exciting learning opportunities for students that they might not ordinarily get within their other placements, because we access lots of specialist services. This learning disability placement is still quite seen as a different placement for adult branch students. Until quite recently, I think the student nurses only had a day or half a day exposure, and a lot of that was university based rather than practical support. We were really keen to have adult branch placement students with us, because there's lots of inequities that people with a learning disability experience when accessing healthcare services. So it's proven to be a really positive placement for adult branch students. We look at what their expectations are and look at how we can match those expectations. As I've said, we've got loads of learning opportunities that they can take part in. So we do tailor-make their 4-week placement to meet their needs as well as ours. Very detailed learning pathway. It's related to the NMC outcomes and also the essence of care benchmarks and effective care practices, and it's sort of all interweaved. And in that, it sort of shows the students what they can expect to learn whilst on placement with us. So really sort of detailed learning objectives whilst they're with the health facilitation team. But then, as I've said, there's a whole array of specialist services which the students can access. And also we've met with those other services to write quite detailed outcomes for students to spend some time with a specialist dietitian, what they can expect to experience and achieve while spending time with a dietitian, as well as with consultant psychiatry or maybe our treatment and assessment unit. So it really is quite a diverse learning opportunity. I think certainly from the Learning Disability Service, a lot of work that we do is groundbreaking and recognised nationally, so there's lots of good opportunities. But I think with the links with the wider service, we've got good systems in place now with our nurse consultant and the qualified nurses' professional training and ongoing development. As an organisation, they're really well addressed, so we're sort of well in tune and up to date with sort of the most contemporary issues within nursing. So obviously we're better equipped to support student nurses. I think it's about building up a relationship, about being empathic and realising that students have obviously moved away from home. It's first time living independently and being aware of all those pressures. Having to make decisions for themselves and go out and get the bits and pieces of shopping in, but then also sort of coming into university is a whole lifestyle change, and about being sort of really open and approachable. I suppose it's reflecting back on your own experiences as well and looking at how difficult it can be. But as well as being approachable and understandable, you've still got to be focused and know that students got to achieve and sort of put them on the right track. And it's about being aware of what resources are there that the students can access for additional support, about having very good relationships with the university and your link tutors and practice facilitators. So I know me as a student, I'm not there on my own. If a student does raise an issue or problem or concern, it's about working together as a team and being part of that wider network.